Global health research really can span an awful lot of different topics, really ranging from field-oriented qualitative research on trying to understand the sort of social determinants of health in different parts of the world, as well as, research down at the biological level, doing laboratory analyses of blood samples to look at direct health outcomes as well. Students can get involved first and foremost by seeking out myself or other faculty members who are doing research relevant to students' passion, what students are interested in. Taking courses that are going to bring you up to speed on either the qualitative or quantitative statistical aspects of doing research. The other thing that becomes important in doing any human-related research is an understanding of research ethics and what kind of sensitivity you have to have when you're doing research, especially in another culture. So gaining some methods background is something that I think is also vitally important in preparation for doing any sort of global health research. Independent research gives students an opportunity to pursue in detail an issue or a topic that they're passionate about, that maybe they learned about in a course or from their own personal experiences, and allows them to sort of investigate this in a level of detail that is just not possible, in the context of a normal course. Beyond that, doing global health anthropological research also provides students the opportunity to develop a skill set that can be important in terms of professional training. So skills in terms of doing global health research can often translate in terms of good preparation for medical school, schools of public health. Simply doing research and the practice of compiling information and learning how to marshal an argument, those are skills that are applicable for any career that a student is going to be going into. Lastly, what we also find is that an international experience, as is often the case with global health, an international experience is a really transformative experience for a lot of students, particularly if they're given the opportunity to interact with people from another culture, from a different background, giving students an appreciation that the human experience, both biologically and culturally, is much broader and much richer than I think we recognize on a daily basis here in the United States. I think one of the biggest challenges is at the front end becoming overwhelmed and potentially biting off more than you can chew in terms of a quarter-long or a summer-long research project. One of the things that becomes difficult sometimes with global health is students being excited, wanting to head off to the field and go collect data on X, Y, or Z topic without any of the background preparation on how you conduct an interview, how do you carry out ethnographic methods, how would you go about systematically collecting biological data on a population and then ultimately statistically analyzing those data. Getting some of the background, both theoretical and methodological grounding, I think is something that is really critically important for students at the front end, because it's going to make the project more manageable, and it's also going to increase the likelihood that students are going to be able to say something at the end of the day from this research. The best and most important advice that I give to students is that they should think concretely about pursuing topics that they are passionate about and interested in. As well, encouraging them that if you've got a good idea, that there are resources within the university, resources within different programs to pursue their goals and pursue that research.